Hello everyone. So today our case of discussion is case number 332 of Madison, a 34-year-old woman present to the emergency department with acute oliguric renal failure. She appears fatigued and reports nausea and generalized weakness. Her BP is elevated and her heart rate is irregular. An ECG is performed revealing sign of hyperkalemia, including a predominant widening of QRS complex. The medical team is concerned about the risk of life-threatening cardiac arrhythmias and decided to initiate immediate treatment. With the following treatment is recommended immediately. So the option is alpha subcutaneous insulin, beta dialysis, Charlie IV calcium, and delta IV furosemide. I'm going to give you 5 seconds so that you can answer this question. Yes, you are correct. The answer is IV calcium. So let's discuss why this is the answer. Our answer is C, IV calcium. So why is the answer? Because IV calcium, like calcium gluconate or calcium chloride, is the first line emergency treatment because it stabilizes the cardiac membrane and prevent arrhythmia. So the patient in hyperkalemia are more prone to going into the arrhythmia. So for the prevention of that, we give IV calcium like calcium carbonate or calcium chloride as a first line emergency treatment to these patients. Okay, let's discuss why not the other options are correct. Our other option A was subcutaneous insulin. Yes, this is correct if we stabilizes the membrane. After that, this is the correct option. IV insulin plus dextrose is used after calcium, but it does not stabilize the cardiac membrane. Okay, so first the cardiac membrane stabilization is important because we have to prevent the upcoming arrhythmias. So after that we will go to different things, and dialysis is the option which is not correct here because we have to try other things first, and after that we will go for the dialysis need if hyperkalemia is refractory, but calcium must be given first to prevent the cardiac arrest. Okay, and IV furosemide is not used in this case because the patient has oliguric renal failure also. And I'm going to in this slide I'm going to discuss the steps that we follow in the case of hyperkalemia. First is IV calcium gluconate. You have to give immediately for cardiac membrane stabilization. After that we give insulin and dextrose for shifting the potassium into the cell, and we can also use the beta agonist like salbutamol which also shift potassium intracellularly, and we can also add sodium bicarbonate to help if acidosis is present, and dialysis if the other options are not working or the refractory hyperkalemia. So this is the steps that we follow for hyperkalemia management. So you have to remember this stepwise. Thank you so much for your attention. Please subscribe to our channel Sword of Knowledge.